good evening to those of you who are joining from this region. Um, of course, my name is Gloria Mathenge, and we are following up on the series of webinars that we have been having in the recent past. And I would like to just to ask Sajan from UNSD to give a bit of opening remarks on the webinar. Sajan, if you would please give some remarks.
Yes, thank you very much. Thank you, Gloria. Good afternoon, dear colleagues. It's really a pleasure to have this opportunity to address you from United Nations Statistics Division in New York. We did have, in collaboration with our colleagues from UN, ECA, and the global CRVS group, organized a set of webinars on behalf of the United Nations Legal Identity Agenda Task Force. The purpose of the webinars was multifold. The first was to present the international standards and the new concepts that has just been adopted by the Statistical Commission and the United Nations regarding the holistic approach to civil registration, vital statistics, and identity management. And that has been adopted in March this year. The second purpose was essentially to provide an opportunity for all of the colleagues, the civil registrars and statisticians, an opportunity to become familiar with the recommendations that the UN Legal Identity Agenda Task Force have put together in order to mitigate the impact of the pandemic of COVID-19 pandemic to the work of civil registration and the resulting vital statistics. The third purpose of the webinars was to provide an opportunity to exchange experiences and practices among countries in Africa regarding their own interventions in times of the pandemic. And finally, we did all of this through the past 2.5 weeks, and we did have, I would say, an excellent representation from both English-speaking and the French-speaking countries. And I believe that this fourth part of the series of webinars that will provide an opportunity to learn from other regions regarding their activities in mitigating the impact of COVID-19 would put, I would say, a finishing touch in terms of providing an opportunity for our colleagues in Africa to have a better understanding on the different ways and approaches that countries are implementing in terms of ensuring the universal registration of all vital events, to ensure the production of vital statistics, which are now becoming even more important and prescient than they were before, and also ensuring the legal identity for all from birth to death. So on behalf of the UN Legal Identity Agenda Task Force, I would like to take this opportunity really to express deep appreciation to our colleagues from UN ECA, to William, Violet and David, and to Gloria from the Pacific community, who is actually chairing the global CRVS groups. Just to finish with the a comment on the global CRVS group. The global CRVS group is actually a group that puts together all of the institutions that have activities in the field of civil.
Sorry, Rajan, can I just interrupt to request that we all please mute our microphone? Please let us mute our microphone so that the call is clear. Thank you.
So the Global CRVS Group is a group of institutions, agencies, both within and outside of the United Nations, both global and regional and sub-regional, that have a set of activities regarding the civil registration of vital statistics. The purpose of that Global CRVS Group is to exchange information regarding different programs and activities that are taking place worldwide in order to ensure the coordination and to ensure the diligent implementation of the United Nations standards for civil registration, vital statistics, and identity management. Therefore, we will have a presentation today to cap the series of webinars in Africa that is coming from Asia. And we will be hearing from our colleagues from New Zealand, from Malaysia, from Australia and Indonesia, if I'm not mistaken, but then Gloria will correct me if there were some changes in the last minute. That will, again, provide us with a better understanding how these countries are coping with the pandemic and the impact on the civil registration. Thank you very much for participating. Again, on behalf of the UN Legal Identity Agenda Task Force, we are really, I would say, privileged to have this opportunity to provide this set of webinars, and we are looking forward to the follow-up in terms of additional support for the countries in the case of this pandemic that obviously is not going to go away. Thank you very much, Gloria. Please go ahead.
Thank you very much, Sajan. Sajan has just spoken through what we've done in the past weeks, and today we are into the third webinar, which will be drawing on experiences of countries from the Asia and Pacific regions. So in the agenda, we would encourage you to please introduce yourselves in the comment section, because we'd like to, and then we will have the three presentations, one from Australia, one from New Zealand, and one from Malaysia. And I would like to introduce the presenters at this point. So Jeff Montgomery, joining from New Zealand, is the Registrar General of New Zealand and also the Chair of the Pacific Civil Registrars Network. We have Amanda, who is of births, deaths, and marriages in New South Wales, and Nazaria Baharudin, who is the Deputy Chief Statistician of Malaysia in the Department of Statistics. So I also want to just take this opportunity to give you a tour of the Pacific and where we sit. And as Jeff, I mentioned, represents, he's the chair of the Pacific Civil Registrars Network. So these are the countries that we have in the Pacific region. They are small island countries, but as well, there are challenges to CRVS. Are not very far from what you see, so a bit more complex with the way in which they are small and the resources that are allocated to them. So with those remarks, without taking much time, I would like to introduce our first presenter and to welcome him to join, and that is Jeff, who will be is coming in from New Zealand. And Jeff, thank you, especially joining at a very late hour of the night. Thank you. Please welcome. Jeff, you're muted.
That might be better.
Please unmute your microphone.
Okay. Kia ora koutou. Warm Pacific Island greetings from New Zealand at the bottom of the Pacific Ocean. Thank you for the invitation to speak tonight. It's 11 o'clock in the evening here in New Zealand, so apologies if I look a little bit tired. It's very late for an old man like me to be up. I'll just turn on my presentation. Here we are. And hopefully you can see that okay. Can you see that, Gloria?
Yes, we can see that well, Jeff. Thank you.
Great. Thank you. I am getting a message saying that the connection is not very good, so apologies for that. So as Gloria said, I'm the Registrar General of Births, Deaths and Marriages in New Zealand. I'm also the General Manager of Services and Access. Because we're quite a small country, I also look after citizenship and I also look after the passports. So we have a comprehensive identity and civil registration service in New Zealand, which is important context for what I'm about to speak of. As Gloria pointed out, this is where New Zealand is, at the bottom of the Pacific Ocean. And New Zealand is a small country. We have a population of 5 million people in total, which has an annual births of 60,000, 30,000 migrants a year who become New Zealand citizens, and about 30,000 deaths each year. Over the last 7 years, we've moved to having 95% of our births and deaths registered online. that's fully registered online with no need for the family to come into an office or to fill in any hard copy paper forms. So that's entirely online. And last year, we also moved the medical certificate cause of death fully online. That's a certificate that doctors complete at the point of a person passing away. Our COVID context is important. We've had just over 1,500 COVID cases and 22 deaths. And at the 15th of June, we had 0 cases in New Zealand. And I'll talk a little bit about how that was achieved. The first cases were in New Zealand on 25th of February, and our borders fully closed on the 19th of March to everyone other than New Zealand citizens. The country went into a full, very harsh national lockdown on the 25th of March, and we stayed in that lockdown for a total of a month, or just over a month. And basically that meant that there was no movement at all within the country. No one went to work. Except for essential services. All shops, restaurants, etc. were closed. And that ended on the 8th of June, when everything apart from the border was opened up, and essentially New Zealand is now back to normal. This is a photograph of our Prime Minister showing the strategy that the government took with COVID, which was essentially to flatten the curve. We had seen the effects of COVID in Europe and in China, and were very concerned that New Zealand's health system would not cope with a sudden influx of deaths. We knew that our funeral sector was quite stretched, our hospital system was quite stretched. And being a small country, we didn't have a lot of room to increase our fatality rates. So the focus of the government and the focus of the work that we did as civil registrars was on flattening the curve, reducing the speed at which COVID was spreading throughout the country. Oops. The first phase of our response was to maintain our high registration levels. Civil registration was deemed as an essential service by the government, and that's under any emergency situation. New Zealand's had a number of natural disasters over recent years. We've had several earthquakes, and we also had a volcanic eruption last year. And through all of those situations, civil registration is deemed an essential service, which means it's a service which must continue even when the rest of the country is in lockdown. We had in place business continuity plans, and these were updated, luckily, for pandemic responses in February. We understood what staff we needed to maintain core services, and essentially what we sought to do was to have 80% of our core services delivered at all times, and those were deemed to be birth and death registration. Other services were able to be put into hibernation. So marriages stopped entirely for a month. We also stopped producing passports, and we stopped doing our citizenship work. Other things like adoptions or name changes or gender changes, all of those services stopped, but we continued to do the essential services of birth and death registration. Before going into lockdown, when we did an environment scan and saw what was happening elsewhere in the world, we started clearing our work queues immediately. So we put staff on overtime and made sure that before things got any worse, our workload was under control. And we also split our staff into 2 teams. So we never had in the office at one time all of our birth registration staff or all of our death registration staff. We split them into 2 teams and made sure that they weren't sitting together in the office. That meant that when we had an outbreak in one of our offices, we didn't lose our whole team. We would still have half that available to come to work. And we also worked very hard with our stakeholders and our customers to move them online. I'll talk a little bit more in a moment about how we achieved that. During the lockdown period, the 5 weeks that we were completely locked down, we maintained the split teams. all of our officers were converted to have a 2-metre distance between every desk, and staff were encouraged to remain distant from each other. And we worked a 3-day roster. So half of our staff worked Monday, Tuesday, Wednesday, and the other half of our staff worked Thursday, Friday, Monday, and that cycle continued for the 5 weeks. And as I said, we stopped all non-essential work, which allowed us to keep those essential tasks operating. One of the keys to our success was the growth of the online medical certificate cause of death service. So we launched this a couple of years ago, very gradually with a small pilot, and we it went live early in 2019. And you'll see on the graph on the screen how that was steadily increasing throughout 2019, but it wasn't until 2020 in February and March that we really got an increase in the rate of certificates completed online by general practitioners. And we got up to 74% at the height of our pandemic lockdown. That was really important in providing us with real-time information on fact of death. So the MCCD in New Zealand is completed on the day a person passes away, and by having it electronically and online, we knew about that death immediately, rather than through the registration process, which is a lot slower. During the crisis, there were a number of specific things that we also did. As Registrar General, I was a key member of the COVID-19 mass fatality response team. So as the Prime Minister's photo showed earlier in this presentation, there was a deep concern that New Zealand was going to face high levels of death and that our systems would not cope with it. So this mass fatality response team was set up to ensure that we had facilities available with the death rate that exceed what we would normally be able to cope with. This team was led by the New Zealand Police Force. It included myself, and it included people from the Coroner's Office, as well as people from the Defence Services and the Ministry of Health. We moved to daily reporting of all New Zealand deaths to predict storage capacity problems. So that was using the MCCD data that we were getting every day. We formed a new database of all funeral directors and their storage capacity. We knew exactly how many deceased were in their storage units and how much spare space they had available and how many staff they had available as well. So our work with the funeral directors was really important, and we had a regular newsletter to those funeral directors to keep them informed. And we moved the online MCCD reporting onto our website as well. So that was the deathdocs.service.gov.nz website that's shown on the screen. You can go and have a look on that website. It's freely available and open, and you can see how that service operates. As well as getting the immediate benefits, we also achieved some longer term benefits. So we now have weekly death statistics being published by the Statistics Department on their website, and this is showing administrative data at its best. So with COVID, people are very interested to know how many people are dying, whether they're dying of COVID or whether they're dying of other things. And we're now providing that information every week on our website. Previously, that information was only available every quarter once the Statistics Department had done their work. But now it's every week, and it's proving very popular with the media and with the public. We also now have a complete data set of our funeral sector, which we're updating regularly through the industry bodies that work with the funeral sector. And we're continuing to see a significant uptake of the online death documents service. And we've made a number of changes to our delivery of services generally. So we have moved now to an appointment-only service at our counters. So no longer do we have people just arriving whenever they like. They now make an appointment by phone or online, and we've removed all cash from our counters. This was something we've been wanting to do for some time, but we took the opportunity of returning from lockdown to implement those changes. People are now used to change, and it's been very successful. Very quickly, here's an example of the daily reporting that was done with the mass fatality response team. you can see the first half of this graph is showing actual deaths that were coming in through the death registration process. And then in the bottom half of this graph shows the projected deaths based on the medical certificate cause of death reporting. So that's extrapolated data that was produced every day. This is a screenshot from the weekly Statistics New Zealand data set. Previously, this was quarterly data. Now it's weekly, and it shows the members of the public that deaths in New Zealand are no higher now than they would normally be. So it kind of was managing some of the excitement that was being caused by the media about death rates. It proved that that wasn't such a concern. And then finally, this is the total number of COVID cases in New Zealand over that period from the 20th of February to 15th of June. You can see the spiking at 90 cases a day, and the little black dots are the number of deaths that we unfortunately had in New Zealand. We did manage to flatten the curve, as the Prime Minister wished, and now we have no community transmission of COVID in New Zealand at all. The only instances we have are in the quarantine centres, which are linked to our border for people returning to New Zealand. So finally, key lessons for us over this period, firstly, was to ensure that business continuity plans are always up to date, and that you have very specific plans on what you will do if your staffing numbers are reduced suddenly. We found that the online cloud-based system gave us great resilience in a crisis. If we didn't have the online systems, we simply wouldn't have been able to provide our services. It was essential that our services were categorised by the government as an essential service in the emergency plans and in the emergency legislation that allowed me and my team to continue to work during the lockdown. Also, as I've said before, the administrative data can be provided quickly. It's hugely valuable and it's popular with the public. And I guess the overall lesson was never to miss the opportunity that a crisis brings. So we've talked about having administrative data available more regularly for many years. We've talked about removing cash from our counters and moving to an online service. We've talked about encouraging more people to use our online medical certificate cause of death service, and all of those things were actually helped through the COVID crisis. Thank you, Gloria.
Thank you very much, Jeff. That was enlightening as usual. I think we will hold off from asking questions at this point until the three presenters are done, and then we can have the questions that are directed to you asked. So at this point, I'd like to invite Amanda. Amanda, you're welcome to make your presentation.
Thanks, Jeff. That was terrific. G'day, everyone from Australia. I wanted to just say thank you so much for asking me to present today on behalf of Australia, and in particular on behalf of New South Wales. So I'll begin my presentation. Sorry, I just have to make it happen. Sorry, guys. So, like Jeff, I'm the equivalent of Jeff at being a Registrar General in Australia. Some of us are called registrars and some of us are called Registrar Generals. So I plan to talk about the Australian context and also the New South Wales in particular, how we responded in New South Wales from a business and staff perspective, from a customer perspective and a stakeholder, and like Jeff, what our takeaways were. So just to give you a little bit of an overview on Australia, so we have 8 states and territories with a total population of around 25.5 million people currently as of today in Australia. There is a births, deaths and marriages in every jurisdiction in Australia, and we have 8 of them. We have 8 of those. We have a closed civil registration system in Australia in all of our jurisdictions. So that means you can only get access to information around civil registration if you're entitled to that. Some of our records are open, and they are those records that are births over 100 years, deaths over 30 years, and marriages over 50, and anyone can get those records. A quick overview of New South Wales. So we have 97% of our birth registrations actually come in online, and 79.5% of all of our customers and stakeholders interact with us via a digital channel. 99.5% of our deaths are registered online by funeral directors in New South Wales, and 98% of our marriages that come in register automatically. It varies around Australia whether or not they have online transactions. Everyone has them in some way, and depending on the state depends on what the percentage is of registration or certificate applications. In New South Wales, we actually at Births, Deaths and Marriages perform around 4,500 weddings per year, and sorry, I pressed the wrong button again. And overall, there's around 40,000 marriages in New South Wales every year. We process around 380,000 applications per year, and we register around 380,000 life events. So of those, we do around 95,000 births, around anywhere between 52 and 55,000 deaths. It does vary, and we do around 40,000 marriages a year, as I said. But the interesting part is, so far this financial year, we've only done 33,000 marriages across the state. So we've seen a significant drop in weddings in New South Wales, and overall across Australia, there has been a significant drop in the last few months in the wedding services around the country because of COVID. And I'll talk more about why in a moment. So we sell around 480,000 certificates a year in New South Wales, and we have around 50,000 on top of that collected at our front counters. We also do a lot of community engagement across the country. In New South Wales, we give away around 1,000 certificates a year to vulnerable people, and we attend community events, and we're also twinning in the Pacific with Kiribati, which has been a wonderful experience as well. So an update on COVID in Australia. So these statistics and the graph that you see are as of today at 3 o'clock. And the civil registration, like New Zealand, was deemed an essential service in New South Wales. And it is in most states and territories, but not every one of them in Australia. So as you can see, we had a total cases of 7,767 so far in Australia that have been confirmed. And we've had 104 deaths, and we've seen a good recovery rate as well. And you can see from the graphs that like New Zealand, we had a spike as well around March, and our government also worked on flattening the curve, doing very similar work as they did in New Zealand going into lockdown. We still had restaurants and cafes open in some cases, providing takeaway foods only, or delivery. So we saw a lot of restaurant businesses and cafes turn from seated places into delivery and takeaway. So that was good. We also have seen a rise just recently, if you look at this piece of the graph, in Victoria. So there are concerns in Australia around what that means for us, and our government is watching that very closely. So our staff at Births, Deaths and Marriages in New South Wales, so we were lucky, like Jeff, we had a business continuity plan. So we've always had those in New South Wales, and I know the registrars around the country in Australia also had those plans. So one of the things we had to do was become remote, and all of our staff were located in 2 buildings, the majority of them in the city in Sydney, where we had around 180 staff. And we basically ended up having to go completely work from home overnight. And thanks to our business continuity plan, we were able to do that very, very quickly. So what we did was we made sure that we had daily team meetings, and they've continued all the way through lockdown until now. And our staff are still working from home. And we also have done fortnightly pulse checks to understand if our staff are okay, you know, how are they engaged, are they feeling, and are they stressed, and are they being able to get through their work and do what they need to do to make sure that civil registration continues. Like Jeff, cloud-based solutions have been important for us, and while our civil registration system is not cloud-based, it is internet enabled, and we can get access to that anywhere we need to. But we've also taken absolute advantage of things like Teams, what we're presenting on today, and Skype for Business. And the things that we've continued across Australia, counter services have continued in most states and territories in births, deaths and marriages. In New South Wales, we went from 8 counters in each of our 2 locations to only 1 counter and a concierge and a receptionist. So that was a significant change for us, and we will actually continue that into the future. Unlike Jeff, we continue in New Zealand, we continue to take cash. However, many of our counterparts across the country also took that opportunity to reduce the use of cash, and I know that they've been quite happy about that as well. And we've seen a significant drop in our weddings, as I said, but we did continue to perform marriages through that COVID period. What we did see was a significant downturn in the amount of weddings that we did and the locations that we did those in. So working with our customers, so we actually, like Jeff, so we launched a new digital offering as well, and that was click and collect for our online applications. So in the past, you could apply for a certificate, but it would have to be posted to you. You can now come in and get that service in our office, in our 2 locations. And we found that 30% of our walk-ins now are actually coming to pick up their collect. We've also had a change to our service delivery in relation to the way that we interview people that want to get married with us. And instead of doing those interviews face-to-face, we do those over phone and Skype. So that's been a big change for our staff as well. And we've also introduced a new way to transact when you do come into our office, and that is we've introduced digital kiosks or booths, and 28% of the people coming into BDM now are actually using those booths if they haven't already applied online and chosen collect. They're doing that, and it takes only a couple of minutes once you've paid using the kiosk to get your certificate. So that's been a real advantage, and we've seen in the last 6 weeks, 1,543 click and collects and 1,200 people using our digital kiosks. And one of the really big things for us, like Jeff, was communication. So it was about using social media, using physical signage in our offices. And these are our 2 locations on the left and the right. And the one in the middle is some of our signage. And we built and launched this all during our lockdown and COVID. So we were really lucky. We only had a very limited amount of staff in our office. However, they did all of this work collaboratively using technology to be able to collaborate and get all of this work done. So working with our stakeholders, like Jeff again, we used phone and email, we used SurveyMonkey, as many different online channels that we could possibly use. And we kept in touch with our funeral directors and marriage celebrants constantly, because the changes to what they could do changed quite significantly over going into lockdown and also coming out. So at one stage we could only have 4 people at a wedding across the country and the marriage celebrant, or 10 people at a funeral. So a lot of funerals were held off, by funeral directors and families to be able to wait until they could have more people gathering. And the same with weddings. That's why we saw such a significant drop around weddings. They've started to increase now, but as they have increased and the changes have come in, we've made sure that we've updated across New South Wales, as have my counterparts across the country. So our takeaways in Australia and in particular in New South Wales have been have a business continuity plan in place. It is so important when something happens so quickly like COVID did. To use cloud-based technology applications such as Teams and OneDrive to enable a remote workforce, but in particular, having a civil registration system, if possible, that you can access outside of the office and even offline is so important. That to review and change how we will continue to work in the future. So it's that whole, using the crisis to get things done, like click and collect and our self-serve kiosks, but also about now taking the opportunity to realise that we work so well remotely. And, from those pulse checks we did with our staff, every single fortnight during the last few months, we've realised that, in fact, while we saw a downturn in productivity to begin with, we've now seen a significant increase in productivity because our staff are happier, so our work is being done much better and quicker than it was before. We've not changed any of our services in relation to what we offered during this time. And we've also seen our stress levels go down in our workforce, which has also been important. But it's about how we stay engaged with our community, our stakeholders, and also our staff, keeping our civil registration system safe and secure from cyber breaches, and also making sure that we continue to register events. So I hope that has been a good presentation for all of you, and thank you so much for the opportunity to do this tonight.
It was excellent, Amanda, and thank you very much for making time to make the presentation. Again, we will wait to have our last presenter and then we'll have the Q&A session. So at this point, I would like to invite Nazaria Baharuddin from Malaysia. Welcome, Nazaria.
Good evening, everyone. My name is Nazaria. Thank you for inviting Malaysia to share the challenges with civil registration and vital statistics in Malaysia, especially during the COVID-19. So next slide, please. Okay, this is the outline of my presentation, which comprise of the CRVS system in Malaysia and the movement control order, the challenges to civil registration and vital statistics, and the COVID-19, the current situation in Malaysia and way forward. And next, I would like to explain a little bit on the CRVS system in Malaysia. Next, please. Okay, in Malaysia, the process flow is quite similar with the UN system. And for Malaysia, we have the National Registration Department that produce the certificates for live birth, death, and fetal death, as well as marriages and for non-Muslim. And we also have other departments like the Department of Sharia or Judiciary of Malaysia, which also provide certificates on divorces, annulments, and judicial separations. And the NRD also has the function in terms of adoptions, legitimation, and recognition. And for birth and death, we have also the Ministry of Health functioning as an agency that register birth and death. And we also have the Royal Malaysian Police that register death. So for the Department of Statistics, our function is towards the right for producing the vital statistics. So we are not like New Zealand and Australia just now, whereby they are similar to our National Registration Department. But for Department of Statistics, we are the ones producing the vital statistics, and the data is provided by the National Registration Department. Okay, next please. This is the process flows of death registration. If the death is happening inside the health facility, then we have the registration at the hospitals. And if the death is outside the health facilities, then we need the confirmation of a medical personnel on the certification of death. So the information will flow to the National Registration Department, and for the Department of Statistics, we will get a copy of the death certificate, and from there we will process to produce the vital statistics on death. Next, please. Next, okay. I would like to highlight also on the movement control order imposed by the government during COVID-19. Next, please. Okay. For Malaysia, we already have 6 phases of movement control orders. And at this point in time, we are at the phase 6, whereby we are on the MCO for recovery. At this point in time, almost all the services is already open, yeah, especially on the businesses. Only like for the schools, we are only open for those who are having exams for this year, the final exam before they move on to colleges. But for the school children, the other school children, I think they are still creating or finalizing the SOP, the procedure for the children to go to school. But most of the activities is already open, but we have to observe the social distancing as well as the basic whereby you have to wash your hands and everything, and to stay healthy. And if you are not healthy, then you have to go to the clinics, and you are not supposed to go around and to the public spaces. Okay, next. Next, please. Okay, during the movement control order, the National Registration Department, they are not open, and because they are not listed under the essential services. So the counters for birth, death, marriage, and divorce registrations were closed starting from 18 March 2020. And the government also announced that all the registration are allowed to be delayed up to 90 days from the date of the MCO ends, when the MCO ends. Next, please. Okay. During the 5th phase of the MCO, the movement control order, then only the counters for birth and death registrations are opened. But it's not really open totally to the public, but the public has to have an appointment to go to the National Registration Department to register birth and death. And currently, the NRD is processing about 5,000 registration daily through appointment for the public. Next, please. Next, please. For the case of vital statistics, as I mentioned earlier, it is being produced by the Department of Statistics Malaysia. For us, we still continue to publish the vital statistics, but we do face the problems of underreporting due to the closure of the National Registration Department offices. So the underreporting events happened after 18 March 2020. And for the month of March, actually about 20% of the registration is underreported. So for the first quarter vital statistics 2020, we still publish as our advanced release calendar on 12th May, and we do present the complete statistics on population, birth, death, for January to March 2020. Next, please. Okay, next slide, please. Next, okay. In terms of the challenges, as I mentioned earlier, we have incomplete data for March 2020 due to the closure of registration starting 18 March 2020. So for a month, normally we will get approximately 35,000 registration of death and 14,000 registration of death, making it for annual registration of birth is about 500,000 and for death about 172,000. So the monthly data is affected, and for marriages and divorces, they are not really affected because normally we will receive the data annually. In the case of Malaysia, as I mentioned earlier during the process flows, the registration at the hospitals for birth and death, as well as at the Royal Malaysia Police for death, the registrations are on, but we do not have access to the data because normally National Registration Department will combine the data and provide us the data. So we don't have access to the data, although the registrations happen at the Ministry of Health and at the Royal Malaysia Police. So in order for us to produce the quarterly data, we have to do some estimates. So for the estimates, we use the 10 years time series data, but we consider the current situation during COVID. Because during COVID, most of the businesses are closed, the offices are closed, only the essential services are open. So we found out that rate of road accident has dropped significantly by nearly 70%. There are only 4 or 5 deaths daily caused by road accidents versus 380 deaths per month and 12 deaths per day for the period 2010 to 2019. So in our estimates, we do take this situation into our estimates. Next, please. Okay, here are the information on the birth and death registration from the month of January up to April. So as you can see, we have underreporting for March for birth and death, and for April, we are slowly receiving the information. Now weekly is about 2.5% for birth registration and 55% for death registration. So we still have to estimate for the rest, and I think for the current situation, we are still not sure whether all of the birth and death registration can be completed with the 90 days extension period as provided by the government. Okay, next. A little bit on the COVID-19, the situation in Malaysia. Next slide, please. Okay, for COVID-19, sorry, a little bit off. Actually, we have a daily announcement on the COVID-19 daily reporting, but these figures is at 27th June 2020, whereby there are a total number of 8,616 confirmed cases, and there are already 8,308 persons discharged, and we have only about 121 deaths due to COVID. Okay, next, please. Next, please. In terms of way forward, as I mentioned earlier, we are going to have further discussions with the National Registration Department for us to have access for the data of registration with the Ministry of Health as well as the Police Department. If we could get this data, actually more than 70% of the data we can get. But since we don't have the access, so we have more under-reporting. So in terms of the Department of Statistics, we also like to review our capacity, especially in producing the causes of death from quarterly to monthly or monthly instead of annually. This is our way forward in taking into consideration the challenges that we face during COVID-19. Thank you very much.
Thank you very much, Nasari, again for another very insightful presentation. I think at this stage, I would like to open the floor for any comments, any questions, and any thoughts that the listeners would like to raise. Please feel free to take on the mic or to raise your hand, whichever way you find easier.
Hello, can you hear me?
Yes, David, we can hear you.
Yeah, thank you very much, Gloria. And I just wanted to maybe to come back if there is someone who needed translation, because we have also Francophone here, the French speaking. So if there is, or you can allow me to just do a kind of recap very quickly.
Yes, that's in order, David. Please go ahead.
Ok, merci. Bon après-midi à tous et toutes. Je m'appelle David Doracea et je vais faire la petite synthèse. Cette série de webinaires est organisée par la Task Force de l'ONU sur l'identité juridique en collaboration avec la communauté du Pacifique et de la Commission économique pour l'Afrique. Sagion de la division statistique des Nations Unies a rappelé que nous avons eu 3 séances. Maintenant, c'est la 3e. Et la première séance a porté sur le partage des recommandations et les normes internationales concernant l'état civil et production des statistiques vitales. Et aussi, il était aussi occasion de promouvoir l'approche holistique des systèmes état civil, statistique et identité des personnes. Et la deuxième séance a été organisée sur l'impact de la pandémie COVID-19 et les conséquences de la pandémie à court et à long terme sur le CRVS. Il a été dit que 7 pays anglophones et 6 pays francophones ont présenté leur expérience par rapport à l'impact de la pandémie. Aujourd'hui, c'était l'occasion de partager les expériences de la Nouvelle-Zélande, Australie, la Malaisie concernant l'impact de COVID sur le système CRVS et la planification pour l'avenir. Il y a eu 3 présentations. Et la première présentation a été donnée par Jeff de la Nouvelle-Zélande. Jeff a dit qu'en Nouvelle-Zélande, on a depuis le 15 juillet, on a 1506 cas positifs confirmés de COVID. Ils ont aussi enregistré 22 décès. Il a bien mentionné que les frontières ont été fermées le 19 mars au terme du confinement national qui a débuté le 25 mars jusqu'à avril le 27. Il a dit que l'état civil est péritorié comme service essentiel en Nouvelle-Zélande, mais durant la crise sanitaire, seulement les naissances et les décès ont été donc enregistrés. Les autres événements vitaux ont été arrêtés. Avec la moitié de staff qui était en place. Et il a dit que les plateformes électroniques ont été encouragées pour la notification des événements et aussi les adaptations des modalités de travail liées au COVID qui ont été entreprises. Premièrement, c'est rendre disponible un rapport au quotidien de tous les décès et nombre de décès pour prévoir la capacité de travail et aussi mise en place d'une base de données de pompes funèbres et aussi élaboration et distribution des certificats de cause de décès en ligne. Comme enseignement tiré, il a dit que l'état civil doit être considéré comme service essentiel. Les plateformes électroniques sont très utiles et aussi il faut veiller à ce que le plan de continuité des activités soit à jour pour faire face à la mise. La deuxième présentation de Amanda, Australie, elle a dit qu'en Australie, on a 84 97% des naissances qui sont notifiées, enregistrées en ligne, et 99 des décès sont aussi enregistrés en ligne, et 98 des mariages sont aussi enregistrés en ligne. Mais il a dit qu'il y a eu une diminution significative concernant l'enregistrement des mariages, même si le service n'a pas été interrompu généralement. Comme adaptation faite due au COVID-19, il a dit que avant cela, il a mentionné que la Nouvelle-Zélande a été capable d'aplatir la courbe de la contamination. Maintenant, comme enseignement tiré, il a dit que l'utilisation des moyens électroniques comme par exemple au moment de faire les interviews avec les fiancés, qui se verraient mariés en utilisant par exemple le téléphone et le Skype. Ce sont les moyens électroniques qu'on a utilisés. Il faut aussi une communication régulière avec les usagers de l'état civil à l'aide des médias sociaux pour l'information sur les dispositions actuelles. Et comme message à emporter, il faut avoir vraiment en place un plan de continuité des services et utilisation des moyens virtuels ou des services en ligne. Et la troisième présentation de Nazari, c'était par rapport aussi le système CRVS à Malaisie. Vraiment, il a expliqué le modèle d'interopérabilité des systèmes d'état civil, statistique, vital et gestion de l'identité. Il a mis en place le monsieur des registres de la population qui va de pair avec la fonction d'enregistrement des faits d'état civil. Et l'établissement des statistiques vitales se fait sur base des informations figurant dans le registre de la population ou obtenues auprès de l'état civil. Et depuis le 18 mars, à Malaisie, on a mis en place confinement comme mesure préventive. C'est ça, et l'état civil n'est pas répertorié comme service essentiel. Et toutefois, certains enregistrements ont été effectués par le biais d'une plateforme électronique ou sur les rendez-vous. Et les défis d'enregistrement des faits d'état civil et des statistiques vitales, il a mentionné que le nombre d'enregistrements a considérablement diminué au cours des mois de mars et avril. Et comme situation actuelle, en Malaisie, on a un nombre de cas confirmés de 8616 et le total de décès, c'est 121 et le nombre total de patients guéris, c'est 8308. Comme on voit à suivre, il a partagé qu'il faut vraiment améliorer la coopération avec les producteurs des événements vitaux, incluant les formations sanitaires, afin de renforcer le processus ainsi que l'accès aux données. Voilà la synthèse que j'ai pu faire. Merci beaucoup. Au revoir.
Thank you, David. Thank you for keeping it very concise and providing such a good summary. I would like to open the floor for questions and any comments, especially because I'm conscious of the time of our presenters and possibly it getting late on their side. So please feel free to ask any questions, at least within the next 15 minutes. Thank you. Yes, I can see a hand from, I can't really tell who, but please take the floor. Please take the floor.
No, thank you very much, Gloria. I am Dumelo Rabuleti from Lesotho. I think maybe to start with, to thank the presenters for very elaborate and very informative presentations. My question is around, while we have seen the impact of COVID on the registration level of various vital events, I think I will be interested to hear the reaction on the analysis of causes of death. I mean, we clearly have seen the impact on the death registration, but have they gone deeper to look at the analysis of causes of death, whether or not as a result of the COVID, and especially the lockdown, there was an effect on causes of death. Thank you, Gloria.
Thank you. Thank you, Raboletsi. Do we have should we take another question, or Jeff, you're ready to take that on? Okay, please go ahead. Please go ahead, Jeff.
Sorry, Gloria. Just to respond briefly to the questioner, there has been some anecdotal analysis done of the cause of death during the COVID lockdown period. Essentially, we did see a small reduction in deaths from things like road accidents and workplace accidents. We saw a reduction in deaths for suicide, but we're expecting those to increase now that the workplaces have opened up again. So a very small decrease in deaths, but nothing particularly significant.
Thank you, Jeff. Amanda, would you like to make any comments?
Very much like New Zealand, although I haven't got any statistics in front of me, I know from watching the news myself in Australia that we have had a reduction in road fatalities in particular, and also workplace fatalities, because there haven't been people in the workplace to be able to have those fatalities. I'm not sure about suicide in Australia, but I know that those two areas in particular, we have seen a difference. We haven't seen a drop in our recording of deaths, though, in Australia. They've continued to be recorded fairly quickly and very similar to normal.
Thank you, Amanda. Nazaria, would you like to comment as well?
Yeah, I think for Malaysia, as I mentioned just now, I think we have a significant drop in terms of rate of road accidents. That's about 70%. So the number of deaths really reduced to 4 or 5 daily versus those during 2010 to 2019. The average rate of death is about 380 deaths per month and 12 deaths per day. So we have a significant reduction in terms of road accidents and the number of deaths. Thank you.
Thank you. Thank you, Nazaria. I hope that provides insight into your question, Rapoletsi. I know you had raised some perspectives during the last call about your analysis in Lesotho.
No, absolutely, absolutely true. I think they did. They did, and I'm very happy with the response.
Thank you.
Gloria, can I just jump in a little quick?
Yes, you're welcome.
Yeah, thanks. This is Brian Mkombo from CDC. I think even calculations of excess mortality would be very helpful, especially that you are just counting deaths and in the situation where maybe the cause of death data is being processed, but just you having a fact of death and you know the numbers of deaths in that period, you can calculate your excess mortality just to see whether there's this effect, whether it's during lockdown or you are seeing a significant numbers of deaths during the COVID period. Even if you don't have that cause yet, I think just a calculation of excess mortality would be helpful. Yeah.
Thank you, Brian.
Thank you.
Thank you. Any other thoughts from the floor? Or questions? I think, Amanda, one area that I would like to ask you to elaborate on is when you talk about a business continuity plan, does that mean that you actually had something that anticipated this kind of situation in Australia? And what exactly do you outline in that kind of a plan?
So for us, it wasn't necessarily around a pandemic specifically. It was more around any sort of a crisis that may occur, and for us, it's very been focused around bushfires. We've had some really bad bushfires in the last several years, and just emergency in general. So we've sat down and looked around what it would mean for us to continue to record civil registration in New South Wales and how many people that would take. And we know that at a minimum, to keep our building open and secure and safe for our staff, and also to continue to print our certificates in a secure environment, and also get those out in the mail, if there was actually still mail being delivered, then it would take us 10 people to do that. If we weren't actually sending certificates out to people, then it would take less people for us, and we wouldn't actually need to come into the office, and we could do that from home and still continue to register all of the events because of our capabilities online. So we have sat down and planned exactly how many people we would need in what areas, depending on the level of whatever the crisis may be, and also understanding if we needed to respond to crises by going out into the field as well, and what that would take, and what it would take for us to set up to be able to do that. So all of those things have been considered in our business continuity plans, and who would be in charge and how that fits in if no one's around. So even during COVID, there's been a senior manager on site in our office every single day. So we know that for a month in advance, we know exactly who's going to be in the office from a leadership perspective, and a backup person for each of those leaders if something was to happen to them or get sick, and the same all the way down to every single team within the registry. So we know who is in charge of that team, they have a backup, and how we could continue whatever the service may be for every single area of the registry. So a lot of planning goes into the process, but we were able to pull that out and go, okay, let's go. We know exactly what we need to do here.
Wow, awesome. And Jeff, did you mention that you have something similar?
Yes, we had exactly the same approach that Amanda had. So the same level of planning. The difference, I think, between the pandemic and the other disasters that we had planned more actively for was the extent of it. So we had planned sort of, Auckland was affected by a volcano, then Wellington would step in and would pick up the legal tasks. So we had those kind of plans in place. What we didn't have until February was a plan for if everything was out across all of our sites, because I have sites in 6 locations, both in New Zealand, Australia and in London. So we could move work offshore if necessary. However, offshore was also affected by the pandemic. So we needed to relook at our plans and think about, okay, if we had 50% of our staff out across all locations, what would that mean? And that was the refresh of our plans that we did in February. So pandemic is a little bit different to perhaps your normal BCP plan that you might have.
Yeah.
Gloria, this is Sergeant. Can I have just a follow-up question for Amanda and Jeff? Thank you very much for the presentations. Indeed, they are very comprehensive and provide an opportunity to understand the functioning in both Australia and New Zealand. Regarding the business continuity plan, my question would be: did you, in developing those contingency plans, did you take into consideration the possibility of perhaps putting together some kind of mobile registration units? In the number of disasters, obviously, as you are pointing out, both of you are really different in nature. You have those that are like a shock disasters, like a tsunami, for example, and then you have those that are prolonged disasters, like this one that is taking over many months. But in the case of, let's say, those shock disasters, do your continuity plans consider developing some kind of mobile units that would go to the place of a disaster and then try to issue the necessary certificates to, especially the birth certificates, to the public? Thank you.
So in New South Wales, while we haven't actually got a mobile setup happening. A similar situation happened recently in New South Wales and other parts of Australia with our bushfires. So we had quite devastating bushfires just before the pandemic, and we combined our services with Service New South Wales, which is another agency within New South Wales government, and they have a mobile service where they literally have a bus that can drive around in the community and offer all of the government services available to the community. What we didn't, while we were in that bus and we were part of that roving service, we weren't issuing certificates. So we haven't taken that into account of issuing those certificates on the spot out in community, but I have no doubt that you know, if push came to shove, like everyone around this room has felt with the pandemic, that we could find a response to that situation and go ahead and actually be able to do that. But at this stage, no, it's not in our BCP.
And similarly, Susan, we've had a similar experience here with the Christchurch earthquakes a number of years ago. So in that case, you know, Christchurch was out of action for quite some time. We just moved our production for Christchurch to Wellington. And I think key to our ability to do that was having most of our services available online or digitally. So actually, the members of the public didn't need a paper birth certificate. You know, we could send electronic data to the places that needed to have that data to provide the services that people needed. And they could get a certificate later if they needed one. But moving to data being transferred rather than pieces of paper was key to making that. No, we don't have any mobile kits or anything like that. Our mobile kits are in the hands of every single New Zealander with you know, their iPhones or their laptops or whatever. They can access their services online anywhere, anytime. So we don't need to have those mobile kits.
Thank you. Thank you very much.
Thank you very much.
Gloria, there is a question from Tanzania.
Yes, please. Please go.
So this is directed to Amanda. Lena from Tanzania would like to understand briefly how the information how you get the information from the marriages that have been celebrated, and how do you receive such information from the marriage celebrants? And she goes ahead to give an example that in Tanzania, a marriage can be done by a priest who gets certificates from the civil registration agency, and then after the ceremony, the priest has to submit to the agency for record purposes, like a copy of the marriage certificate. So our question is to briefly understand how marriage is being celebrated at the moment. Thank you.
Thank you. So it's actually very similar. So in Australia, it's the same across the whole country. It's a piece of federal legislation. It's not state-based. So a marriage celebrant, whether that's a civil marriage celebrant or a religious marriage celebrant, has to fill in the forms or the notice of intended marriage 1 month before the wedding day. They fill in the forms and they keep them until the wedding is performed. They then fill out the certificate of marriage on the day as well. They give the couple it's a government form that's filled out. It's called a certificate of marriage that they give the couple on the day, and it's a numbered form. It's not accepted everywhere as an identity document though, so that's really important. What the Minister of Religion or the civil marriage celebrant does is then send in the paperwork that was done 1 month before and the certificate that they filled out and signed with their witnesses on the day into Burstessa Marriages in the state where the marriage occurred, and we register it in that state. Some of the states do it online. So in New South Wales, we have an online service that either ministers of religion or civil celebrants can use if they choose to. So we have around, I think it's around 60% of our marriages are performed. About
Is that you? Oh, no. Hello. Sorry, Amanda. Please, can I
That's
request
okay.
that we mute our mics? I think that is coming from one of the delegates. Let's mute our mics, please. Thank you, Amanda. Please proceed.
Well, it's only because it's late at night, Gloria, that my little boy hasn't walked in and said, "Hi, mummy." Yeah, it's actually all sent into the registry via online or via the mail, whatever the celebrant chooses, and we register it, and then we send out the certificate if the couple have applied. And in Australia or in New South Wales, the couple can, the Minister of Religion or the civil marriage celebrant can apply for the certificate on behalf of the couple when they get married, and we'll send the official government one out off the civil registration register out to the couple after their wedding. So I hope that answers the question.
Yeah, I hope that answers the question too. Hosea, is there a follow-up question to that?
Gloria, she says it does answer the question.
Wonderful. Do we
All right, thank you, Amanda.
have other questions or comments? I think I'll go for one last question, Amanda, and Jeff and Nazari as well. I'm interested in how you raise resources for your civil registration offices. Not a project program, or is it how do you generate resources from elsewhere, and how does that happen?
Okay, I'll start answering that question, Gloria. So in New Zealand, most of the costs of civil registration are paid for by user charges. So people purchasing certificates from us or paying for marriage licenses. There's a small amount of money comes from the government to run the core registry systems, but most of our revenue comes from either sale of certificates or sale of data to other government agencies. So that's how we fund most of our investment. We have an ability to carry money forward between financial years. So in some years we will make more money than we spend, and we're able to carry that forward into future years to invest in technology and other things that we need going forward.
Thank you, Jeff.
So in Australia, the states and territories are all different. In New South Wales and Queensland, we are completely self-funded, and Victoria is almost completely self-funded, but all the smaller states are on budget, so the government gives them the funding to run the business. But in New South Wales, I have to return a profit back to government at the end of each year, and we raise our money through the sale of our products and services, so certificates. And as I said earlier in the presentation, we're the biggest marriage celebrant in the country, and we do around 4,500 weddings a year. So we earn quite a bit of profit out of that service. And also our family history services bring in about, I think it's around 16% of our profit margin comes from our family history records. And in New South Wales, we hold those from 1788 onwards. So most of our, and like Jeff, we also make money out of the sale of data, both at a state level and a national level. So we have some national death data sets that we sell as a country, and we all take percentages of those profits. And the sales not only give us the ability to return a profit back to government, but fund our registration side. And for every sale of a birth, death and marriage certificate, we keep a percentage to then give free certificates to our more vulnerable people in our community.
Right. Thank you so much, Amanda. Malaysia, would you like to comment?
Okay, for the case of Malaysia, most of the operation of the registration department is funded by the federal, and most of the charges is also already made free, except for extraction of records and late registrations. A very small amount in terms of revenue, but mostly funded by the federal government.
Thank you very much for that. I was I was particularly asking because from the responses that countries provided on their COVID-19 survey, there were concerns around budgetary resources being affected, and also like resources devoted to CRVS, civil registration work being diverted to other more pressing government needs. And Amanda, I think you raise an important point of also being cautious about a particular segment of the population that might be vulnerable when these kind of fees are raised, and the need to ensure that we balance that. I think do we have any other comments or questions? Then with that, I'll just invite our presenters to give any last comments. We can start over with you, Malaysia. Would you like to give any final closing remarks?
Okay, thank you, Gloria. I think for the case of Malaysia, not only on vital statistics or the registration, but for other areas also, I think COVID-19 also leaves us with opportunities. Like for us, as I mentioned in the way forward, it's the opportunity for us to work with the National Registration Department, for instance, in getting the data from the Ministry of Health as well as the police, rather than wait from the National Registration Department, because the data is already there, the registration is already there, but only the certificate is not produced by the National Registration Department. So I think we should think about opportunities on ways to enhance our services for the public. Thank you.
Thank you. Jeff? Jeff, are you still there? Amanda?
I think for me personally, the thing that I've probably learnt the most out of this is a bit like what Jeff said earlier about never, let a crisis go to waste, and be able to leverage what we can when we can, but also look after our vulnerable people. As I said before, it's something that's really important and dear to our hearts, to make sure those people who are most vulnerable are looked after in our communities. So yeah, using what we can to be able to better serve our citizens in our countries or states where we are, and making sure that civil registration continues and continues securely is really important.
Yeah, thank you very much. I think, Jeff is back. I thought he had rushed off. It must be very late on your side. Jeff, we were opening the floor for any final remarks.
Oh, yes, I'm sorry, Gloria. I lost all connection for about 3 minutes there. I have no final remarks.
All right. Then with that, I think I'll hand over to Sarjan. Sarjan, are you there?
Yes, I am. Can you hear me?
Yes.
Thank you. Thank you very much. I would like to take this opportunity to really express our appreciation to the presenters. And this is again an opportunity to learn how the national systems really cope with the issues that were triggered by the pandemic, and how they're trying to actually understand the necessity to develop different strategies in terms of ensuring the services to the population are not interrupted. So I believe that what we have learned here is really that the digitization of the civil registration is one of the most, I would say, strategically important way to ensure the delivery of the services to the population. And the second is the importance of the business continuity and the contingency planning for cases like this kind of pandemic and any other disasters, man-made or natural-made disasters. So with these two, I would say, points, and also the understanding that we need to push the governments to realize that civil registration must be an essential service and that needs to be in motion even in the case of pandemics, even in the case of disasters. And I believe that Malaysia it will definitely take this message to heart and then ensure that the universal registration of all vital events is really considered a critical and essential part of the government services. So with this, it is really my pleasure to conclude this set of webinars that have been organized for our friends and colleagues in Africa. I wish to express my appreciation to ECA, to, of course, the Global CRVS Group and Gloria, and to just ensure that the message that this is just the first set of webinars. We are going to continue to work with all the countries through the UN Legal Identity Task Force to provide any kind of support that we can provide in terms of recommendations, in terms of advice. And in some countries in Africa, we are running a pilot program that is gearing to aiming at ensuring the modernization of the civil registration, vital statistics, and identity management. So with this, I wish you all a pleasant day and pleasant night, and as may be the case, and thank you all very much. Thank you and goodbye.
Thank you. All right, goodbye, everyone.
Goodbye.
Goodbye.
Thank you.
Goodbye.
Goodbye.
Thank you. Thank you very much.
Good night. Goodbye.
Good night. Good night, Jeff. Good night, Amanda. Bye-bye.
Good night. Bye.
Bye, and thank you very much.
Gloria, thank you.